DNA methylation, aberrant DNA methylation patterns underscore all disease. It's now understood that influence can be antecedent, it can participate in triggering, and it may also mediate the course of disease. This has been best researched in cancer, where we see cancer as a global hypomethylation process. So if we were to take the whole epigenome and look at all the methylation marks, we would see a movement towards hypomethylation. But if you look at regions, if you look at specific genes, you'll see pockets of hypermethylation. In particular, we see hypermethylation of tumor suppressor genes, actually quite frequently. Important genes such as the BRCA or MGMT, classic tumor suppressor genes can be hypermethylated and shut off. And this is done in that tumor microenvironment where they hijack really efficiently the epigenetic apparatus. Additionally, we can see regions of hypomethylation in cancer where oncogenes are on and allowed to express. Now, we also see it, as I said earlier, in other disease states. So we can look at cardiovascular disease or autoimmunity and see these aberrant DNA methylation patterns time and again. An area interesting to me is aging. So again, when we look at aging, we see this global trend towards hypomethylation, and you certainly see homocysteine rise. Homocysteine is a reasonable surrogate marker of DNA methylation activity. But again, we need to think about the regions of hypermethylation also occurring in this population. As functional medicine providers, we are so well positioned to nurture optimal epigenetic methylation. We're already doing it with our patients, which is so incredible. But I want to move through some of the specifics so we can think about influences and modulate those as indicated.